Hello, good afternoon, everyone, and welcome to this Connected by Data hosted event. My name is Adam Cantwell-Corn. I am the Head of Campaigns and Policy at Connected by Data. We are the campaign for communities and civil society to have power and a powerful say on data and AI. That involves mobilizing civil society, working with civil servants, policymakers, politicians, and community at the grassroots. We do that from a position that these questions that we'll be engaging with tonight are not just questions of technology, but are also questions of values, politics, perspectives, as much as they are technical. So before I hand over, just a very quick thanks to all of the panelists and John for chairing. We pulled this together in just a very short time as the election was called. So it's really great to have this really important debate that sets up the debate around the election, but of course, as we move into the next stage after that, whoever the government may be. Just a very brief housekeeping. We are recording this event. We encourage you to keep your cameras on, but if you would like to turn it off, of course, by all means do so. Please do use the chat to engage with one another, and we'll see if John, as he's chairing, can pick up anything that's pertinent to feed into the conversation. The final thing to mention is that at 8 p.m. tonight, there will be another event which involves political party representatives, and we can share a link to that in the chat as well. So yeah, in the meantime, enjoy the event, use the chat, and feel free to get in touch with us if you'd like to discuss our work on public services and data and AI and anything else at all. So with that, over to you, John.
Thank you very much, Adam, and welcome to all of our viewers and panelists for this online discussion. Now, of course, the title of this discussion makes the heroic assumption that Labour is going to win the election. So we're all going to look rather silly on July the 5th if that doesn't happen, but I hope our debate is going to be relevant to whoever wins. And Labour is certainly pledging to reform public services with tech, but it hasn't been one of the highest profile issues during the election campaign itself. It has been eclipsed by rows over taxes, gambling and D-Day events, but it will have a very big impact on the tech sector and the public. But there is clearly not just one way to adopt technology in the public sector. There are lots of voices within the tech community seeking to influence the next government. Who should the government listen to and how should it proceed? The goal of this discussion is really to bring out a lot of these strands of the debate, and we're going to use a question time format. So we'll have 3 questions from people in the audience to focus our discussion on AI, digital and data, and then we'll give our panelists the right of first reply. But we'd love to hear from you, as Adam says, because there are many more perspectives than represented on this panel. And please introduce yourself in the chat, use it to answer questions that get posed, say whether you disagree or agree with the panelists, ask follow-up questions and flag areas you think need to be addressed. And also we'd be grateful if you could share any resources you think people should be reading on these subjects. We're joined by 4 panelists today, Jeegar Kakkad, who is Director of Government Innovation at the Tony Blair Institute, James Plunkett, who is the Chief Practices Officer at NESTA and Behavioural Science Team and author of End State, Caroline Selman, who is the Senior Research Fellow at the Public Law Project, and Jeni Tennison, who is the Executive Director of Connected by Data. So we're going to start with our first question from Miriam Jones from Liberty. Miriam, could I pass over to you to ask the question?
Hi everyone, thank you for putting on the event. My name is Miriam and I'm a Policy and Campaigns Assistant at Liberty, human rights organisation. So at Liberty, we've been working on rights-based approach to use of AI and digital policing. So we've seen over the past couple of years, in particular, the rise in the use of AI across all public services, whether it be universal credit algorithms, which pushed numerous people into poverty, plans to give the Department of Work and Pensions powers to spy on people's bank accounts to assess whether they were abusing the system, which were thankfully fell through with the Criminal Justice Bill. Artificial intelligence and policing is increasingly being relied upon as well, but this isn't new. The controversial gangs violence matrix was very basic but very powerful spreadsheet that acted as a watch list of people who the police designated as gang nominals based on vague criteria and information such as where people lived, who they were friends with, whether they'd been a victim of a crime. And this had implications for people's access to benefits, their ability to go to college or obtain housing. Thanks to litigation by Unjust, the gang violence matrix is no longer being used, but it is being replaced by other discriminatory tools. At Liberty, our recent work campaign, Holding Our Own, has found that non-policing solutions to social issues that work with communities and don't prioritize a policing and criminal justice response. But instead, what we're seeing is the government doing the opposite of this, not responding to social issues, further supplementing bad policy or dodgy tech with artificial intelligence programs. But we know that AI isn't neutral, and tools like facial recognition technology actually exacerbate systemic oppression of marginalized groups. And our landmark legal case in 2020, R versus Bridges, saw South Wales Police declare the South Wales Police use of tech as unlawful, breaching equality, data protection, and human rights laws. So it seems like AI and tech is being the use is being sped up and is not really letting up. So my question is, after a lot of introduction, is with the police gathering more and more data into things like the Matrix database, rolling out facial recognition and experimenting with different algorithms to prioritize patrols, Liberty believes that many of the most harmful uses of AI need to be banned outright. So the question is, what else does the government need to do to safeguard people's rights and enable redress when things go wrong?
Great. Thank you very much, Miriam. Caroline, I wondered if I could start with you. The Public Law Project obviously focuses a lot on transparency around public sector algorithms. How do you answer Miriam's question?
Thanks, Miriam, and also John. So like, as John was saying, we've had a real focus in the first instance on transparency. And that's because of the fact that we think that transparency is important in its own right, but it's also fundamental to us being able to access any of the other rights or safeguards that we think needs to apply in this context as well. Because if we don't know what AI and automated decision making is being used and how it's being used, you can't begin to have a conversation about whether that's appropriate, whether it should be being used at all, as I think was implicit in the question from Miriam, whether people should give their trust to it, and also for seeking accountability and redress if things do go wrong. And the reason we've also focused on it is because we think it is something that the government could quite quickly and easily do something on to improve things from where they currently are. So a positive thing that has already been developed is the algorithmic recording transparency standard. So I suspect many people on the call are familiar with that. For people who are not, it's essentially a standardized database of a standardized set of information that public bodies should be putting into the domain in relation to where sort of automation algorithms are being used to make important decisions about people. It's something that is not perfect. We think that there are categories of information not included with that, which should be, but if it is adhered to sort of and complied with meaningfully, it would quite fundamentally shift forward aware transparency about how stuff was being used. But we know from other jurisdictions that where similar things have been adopted, that there's a real risk of non-compliance or bad compliance with those things. So we're also calling for the fact for that to be put on statutory footing, so it can be something that where compliance is legally enforced to make sure that that happens in practice. And we're also really keen that any future government learns from other jurisdictions to ensure that people are also notified at the time that decisions are made about them and given the information that they need to understand how decisions have been made about them. But I also want to be really clear that transparency is important, and it's something that we really hope that the Labour government will, if they become government, will consider introducing. We were pleased that they supported amendments that we put forward as part of the recent data bill process going through the Commons and the Lords, but it's not sufficient. I'm not going to go into too much detail of the other stuff at the moment because of time, but we might pick up on it in terms of the ongoing discussion. But other points for Labour to really look at and consider is the fact that we know that the current regulatory landscape is fragmented and not sufficient to cover the current settings. It's been developed at a point in time which was before we had a lot of the tech coming forward. It doesn't necessarily reflect how it's being used, and there's a need to sort of fill those gaps and think about how we fill those gaps. But in addition, there are bits of the legal framework which do have stuff to say in terms of how stuff is being used just now. And I'm conscious of thinking of the law not just as something which helps us to ensure redress, but also in terms of thinking about what good decision making should be looking and how we can use that as a guide to what good and fair and lawful and non-discriminatory decisions look like. So public law, which is obviously Public Law Project's focus, is something which has been designed about over time, iteratively, about how we have come about to having fair and lawful and non-discriminatory decisions. That doesn't change just because of computers involved, but it does need to adapt to reflect the specific ways that plays out in terms of decision making.
Okay,
so sort of
great.
three things that we think could be introduced are improving transparency, closing the gaps, and also looking to existing legal principles to improve things in the meantime.
Okay, great. Thanks for that. Jeni, you wanted to come in.
Yeah, so I think I'm also really worried about government taking quite a gung-ho attitude to adopting AI without considering some of the broader problems that might rack up as a consequence of that. And I'm sure Jeegar, who I see just put up his hand, will talk about the report from TBI on governing in the age of AI, which was co-written by faculty, and I found that particularly worrying in terms of implying that the only kind of control that citizens should have was around privacy, or that biases could be coded out of algorithms, which we know is not the case. And if we look at the stuff that Miriam talked about, but also look at the Horizon scandal or the carers scandal, when you get algorithms embedded in these big bureaucratic systems that really have no consideration or care for the people on the sharp end, then bad things happen. So from my perspective, it's not enough to just have the kind of transparency and the lawful kind of redress at the end of the process. We need to get people involved and multiple stakeholders involved much earlier in the process. We need to get massively better at engagement around some critical thinking around impact assessment, not just on individuals' privacy, but on the impact on communities, like equality, looking at environmental impact, looking at the relationship between citizens and the state. And we need to get massively better at monitoring and reporting systems that do detect when things go wrong rapidly. It's great that there's Public Law Project and Liberty and others out there who will act as kind of canaries in the coal mine when things go wrong, but we need to really act much earlier in the life cycle of these systems. And I think Labour's going to be coming into an environment where there are going to be a whole bunch of systems that have been put in place over the last 14 years, and that it really needs to do an audit of those systems to see where it's going to be on the hook for where they have been going wrong over a long period of time.
Jeegar, we've had three very powerful expressions of concern about how the government uses AI and the worries of algorithmic discrimination. TBI, as has been mentioned, tends to be a big enthusiast for the use of this technology in the public sector. So how do you respond to those concerns and make the positive case? How can we reassure people that this tech is not going to be abused?
It's a great challenge, and thank you, Jeni, for mentioning the report. I will just pop a link into the chat. At TBI, I think there's a couple ways in which we think you can address some of these concerns. So one, in the report, we talk about what we call a pairs framework as you're beginning to design anything that might look like algorithmic decision making, needs to meet these criteria. Otherwise, from our perspective, probably shouldn't be designed. And the pairs framework is as follows. So first, the P is predictable. So if it's making a decision, is it going to make the same decision, with the same input, so that the outcomes of decision making is predictable? Is it explainable, so that both the citizens and caseworkers understand what's happening and the decisions and the ways in which it's made. It needs to be accountable. It cannot be a black box that's sat somewhere on a spreadsheet or in a department. There has to be individuals accountable so that if something goes wrong, we know where to go. And so that leads to R, reversible. When I talk to my teams about algorithmic decision making, proactive public services, I describe them like a set of dominoes that are tipped over. And it can't act like that because it's really difficult to pull the dominoes back up. If you have algorithmic decision making, you need to be able to undo it in case something goes wrong, because that just has to be kind of the core, the basic, the fundamental through which this is designed. And the last bit is sensitive. The last element of the pairs framework is sensitive because a lot of these decisions are going to be made about individuals that are in or households, families, communities that are in sensitive moments in their life. And unless the algorithm, the proactive public service power, whatever you want to call it, and you can show that it's meeting these criteria, we actually don't think it should be implemented. We need to kind of go back and show that it can. The other way we think you can give individuals a degree of more control is through a digital ID, right? And this is not something that is done by the Home Office or someone else. This is a decentralized digital ID that is in the control of the individual, that gives individuals transparency on what data is being held by them, how it's being used, and they can have a snail's trail of who's using it and allowing them to opt out, opt in about what data they're sharing with him in terms of public services. And that type of transparency control is what enhances privacy when you get to thinking about, okay, how are you going to digitize public services and begin to use AI to help navigate some of these.
Okay, great. Thanks for that. James, I want to bring you in here. First of all, what's your overall take on this as a subject? And I wondered if in particular I could pick up on Miriam's point. What should we ban, if anything? Where is the permissible and impermissible use of this technology in the public services?
Yeah, great question. I mean, I think so I completely share the concern about the sort of egregious uses of these technologies or the sort of reckless uses. And as Jeni said so well, if you adopt these technologies sort of foolishly in overly bureaucratic and inhumane systems, then they just make those systems even more sort of inhumane at scale. So I was doing some work in Australia recently, and they've had the robo-debt crisis that people may have heard of, which was this disastrous system that tried to automate the collection of debt and drove many people into bankruptcy, and not dissimilar to the Horizon crisis in the UK. So I share the concern. I suppose I just think one of the biggest problems when these crises blow up is that we then don't make good use of these technologies for good because we get scared and the trust dissipates, and people like the people in this meeting become mainly skeptics, right? And we spend all of our time talking about the risks, and I worry about that. And I do think it's interesting where the politics of technology is these days, that if you go back, we have not had a good sort of 15 to 20 years on technology, have we, in terms of its uses across wider society. And so understandably, if you like, progressives are in a place of deep skepticism. And I do think that's quite different to where we were in the mid-90s, say, or the sort of early 2000s, where there was at least a kind of culture around technology and progressive politics that saw some real excitement in the early internet and so on, and there was movement around that. So yeah, I suppose that's just a bit of a note of caution. Let's not get overly swept away by the risks, and also think about the opportunities. And just specifically on your question, I think there's a really interesting overlap between discrimination law and equalities law and the use of these technologies, and regulators are not kind of grabbing that nettle. And there's some quite specific changes we could make, and might pop into the chat, that I think would help big regulators to really push companies on not contravening equality law in the way they use these technologies.
Okay, great. Carol, I knew you wanted to come back in, and we had a good question in the chat from Anna Dent, who was saying that governments tend to listen to the big shiny promises that tech companies make. How do we make sure that civil society is heard in this debate?
So I'm just coming back to it, because I think this falls on a bit from what was just being said by James, although the original trigger for it was the reference in terms of, digital ID. And I think I guess one of the concerns I think is that quite a lot of the focus has been around about the concerns about privacy and data, which is right, there should be concerns about those, but it is a much wider concern about how decisions are being taken about people and the implications of those, which is also where there's a real deficiency in kind of both transparency about it, but then also debate about it and understanding about how you then safeguard it properly. And I would just sort of echo and reiterate a lot of what Jeni was saying in terms of the fact that, like I say, a lot of public law tends to come in at the end when it's about seeking redress because things have gone wrong, but it is also about understanding, ideally you don't get to that stage, and about how you prevent that, and that is about going upstream to those original decisions. And I was, I guess, advocating for the ATRS, but one of the downsides of the ATRS currently is the fact that it comes in after a decision's already been taken and it's public, and there needs to be sort of consideration at a much further sort of earlier stage about understanding what is being introduced, how is it appropriate at all, and sort of extending that transparency to as early as it can in that process.
Okay, great. Jeegar, do you want to come back on that? And there's an interesting question from Jack Stilgo in the chat as well, who has thought that you had a good framework for machine learning systems, but do any of them tick all 5 boxes while still remaining useful?
I think you can, and we should try, right? I think if we can't try to tick all 5 boxes, to Caroline's point about how do you move upstream so that you're thinking about the decision making before you have to get to the redress point, right? That's such an important issue to tackle, and if we have to keep trying to push our systems to deliver that rather than just doing systems to it will be really easy to get caught up in the efficiency, the cost reduction element of systems, and that is valuable given the state of public finances and public services, but it needs to also address those upstream concerns and challenges where we're going to think we're going to go that way. I have lots of examples of actually, it's really easy to mistake that AI is this big automated decision making, when in actual fact, what AI is really good at is processing lots of unstructured data to provide the answer in an intelligible way for humans, whether it's nurses, caseworkers, etc. I'll give you a great example. One, faculty has a off-the-shelf system that can go into hospitals and do predict when a patient comes in, the time they're going to spend in a bed. And so it's helping reduce effective bed occupancy rates to safer levels. But what it does is give information to nurses and empower them to make quicker, more informed decisions about which treatments patients need, what beds they need. Those are types of AI systems that are actually kind of really powerful, which is what our public services need, but also it's empowering individuals, not something that is happening to individuals without any control.
Okay, great. Jeni, I'll give you the last word in this section, but please be brief and then we'll move on to the next one.
Thanks very much. So I think that that's a really lovely example, Jeegar, of the kinds of systems that we would not be so worried about. I think what's really needed is to have some kind of proportionate response where we understand that there are some systems that are going to impact not only individuals, but also the communities that they're part of, and that we need to have proper governance in place. And to understand that it's not enough for the developers and the procurers of those systems to say this is great. It needs to have some kind of democratic mandate, and that needs to come, I think, from better consultation with the public to get that.
Okay, wonderful. Right, we're going to move on to the second question. So Margaret from the People's Panel on AI, can I ask you to pose your question, please?
Hello, my name is Margaret. I'm one of the people who was part of the People's Panel on AI that Connected by Data ran during the AI Safety Summit last November. But more normally, I work in a cafe in Lancaster. I talk to many older people whilst working there, and I hear what they are saying. It's now so difficult to access over-the-counter assistance with personal finances, the paying or querying of utility bills, the making of a simple doctor's appointment, or the reissue of a prescription, as we are faced with the closure of local banks, post offices, even the smaller shops, and encouraged to conduct all our affairs online. a remote world minus all the personal contact and friendly interaction. These changes to procedures are felt most acutely by the elderly. We have taken away from them the element of choice. For them, face-to-face contact will always be important. As technology advances, how will they cope? Are we prepared to educate them in their struggle to, for example, understand the concept of a chatbot, or will they be left behind? Many people of my acquaintance may still have potentially 2 further decades of life ahead, ironically due in part to amazing developments in AI-based medical procedures. Do they deserve to spend these later years confused, frustrated, and ultimately lonely? Or can we find ways to gently ease them into this world of change, to share with them the hopes as well as the fears that they are experiencing for a future which is theirs as well as ours? My question is, how much should local government, care services, and doctors' surgeries adopt digital tools, and how should they avoid leaving elderly people behind?
Great question. Thank you very much, Margaret. And James, I'm going to come to you first on this one. You've been exploring the idea of a kind of local government digital service or alliance for a while now. So how do you respond to Margaret's challenge that we should not leave people behind and we should humanize all of our digital interactions?
Yeah, I agree. It's a great word, humanize. I think, and I think often the goal that we're sort of aiming for with the use of these technologies is that you make systems both more technically adept, if you like, and also more human at the same time. And that's a test of if it's worked well. That's how they end up feeling. I saw this a lot when I led the digital teams at Citizens Advice, which is obviously a charity that has huge volumes of interaction with the public, much of it face to face, sometimes over the phone, sometimes chat, sometimes online. And one thing I was often struck by was actually it's not quite, sometimes we talk about these trade-offs as in more digitally enabled services are less accessible, and often that's not the case. And often the least accessible services at Citizens Advice sometimes are actually our face-to-face services, because for certain groups of people they couldn't get in to see a face-to-face advisor, and they found web chat more accessible. So it's a complicated set of trade-offs. And when you use these technologies well, as we sometimes said at Citizens Advice, you obviously free up time for the advisors to spend less time doing the bureaucracy and the write-ups and the kind of recording of notes, and more time face-to-face for the kind of interactions you're talking about. You obviously make services sort of more accessible for other folk, and therefore you can reallocate those resources to people who need to come in face-to-face. And often also, actually, even when we upgraded digital services, they became more accessible because they'd be using more modern technologies, and so therefore people could use screen readers, for example, if they were partially sighted, because by modernizing the service, it then interacted with screen reading technologies, and it was more accessible for blind people or partially sighted people. So I suppose it's I just always push for real specificity on this debate, because for sure it's not about bluntly digitizing services and just leaving groups behind, but I also really don't think it's true to say that often by investing in technology you make services more accessible to all those groups if you get it right. But it's all the key is in the detail.
Okay, Jeni, could I bring you in on this? You've been thinking a lot about these kind of issues, and I mean, one of the striking things about what the government is going to have to do is do more with less. They're not going to be have a super abundant resources. So by listening to every community and listening to everyone's concerns, building in lots of additional considerations to these systems, are we going to come up with incredibly cumbersome and expensive and overburdened systems, and almost giving into a kind of digital NIMBYism?
Yeah, I think this is one of the concerns that people have when we talk about bringing the public along on the journey, or when we're developing these kinds of tools. But the way I think about it is as a kind of extended user needs research. Really, it's like actually really understanding what kinds of interactions people actually want to have with public services. And actually not assuming that that's going to need to be a digital interaction, because for many people in particular circumstances, they will want to have the complex, nuanced conversation with a real human being rather than interacting with the digital service. it's only by really understanding their full needs that we're going to be able to design services that actually work for the full range of people that public services really need to address. We're not dealing here with kind of commercial services where people can like take them or leave them. We're dealing with services that people actually have to take part in all of the time. So I think that Labour really needs to take that kind of view, not assume digitization as part of the service design rather than the whole of service design, or rather than even the starting point for service design. It needs to keep these mechanisms that allow people to talk to people. And it's not just about the digitally excluded people, but it's also about just from particular situations where things are complex for individuals. And it's also, I think, James touched on this, about public servants having fulfilling jobs. And when you're just managed by a case management system that is telling you what to do all of the time, that is not a fulfilling job, because you're not able to you feel like you're being watched all the time. You're not able to interact with people at a personal level in a way that makes those relationships fulfilling. And then we do need to have that kind of extension of the user needs analysis to avoid costly investments in tools that people don't actually adopt, and to one of the things that's found, when people actually have a say over the design of tools, they are more likely to adopt them. So getting the civil servants and public servants who are going to need to be on the other side of these tools, as well as citizens involved in their design, I think will lead to a much smoother adoption and therefore save money in the wrong one.
Great. Okay, Jeegar, you have your hand up. Can I get you to come in on this? I mean, do you think that's practically possible, what Jeni is suggesting? And I know that you've done a lot of work at the Tony Blair Institute on an NHS app, for example, which is owned by the patient. How is that going to work in practice? How are we going to ensure that people like Margaret are able to use it and not use it if she doesn't want to?
Yeah, we at TBI would say that as we're thinking about how to modernize public services, we should start with digitization first. And that is what will lead to the transformation of public services. Now, Jeni's point about thinking about user needs and how the user will want to interact with this, and Margaret's points around what does this mean for certain communities, whether it's elderly, remote communities, etc., is so important. We've tried to go around the world trying to learn about how other governments are trying to tackle this problem. The best conversation I had was with the government of Singapore, where they are at the forefront of automating a lot of their public services. But their center of government, one of the questions they always ask when they're designing these to be digitally first is, where do we insert friction? Where do we insert humans? Because that makes sense for the user. And one thing they've designed is in some of the communities that have language needs, elderly people tend to be have elderly populations, etc., is create community hubs with humans, staff, where anybody with a need can go into the hub and talk to humans first. That individual is a government employee that might have access to all the information, all the health records, whatever it is, and can help the citizen coming to them. But it's a human, because that's an option that user wants, and is actually going to be more helpful. And to Margaret's point about closures of post offices or bank branches or community hubs, we think that's a problem, because I think you do need some of that in local communities to be able to anchor this kind of human first option for people, so that when people want to choose it because it meets their needs, or they want to choose a remote thing because they can't get to the hub, those options are available. You start digital first, because then in that hub, the caseworker, the individual there, has the resources, the knowledge to be an intelligent resource for the citizen when they come in. But absolutely, we have to factor that into the design.
Right. So getting young people to train older people on the use of digital technology sounds like a great idea for the National Service if the Conservative Party actually win the election. But Caroline, do you want to come in on this?
Yeah, I'll be brief, so as not to duplicate, but just picking up on some of the points about complexity of digital exclusion. I think the first, just some that we've done quite a bit of research around about digitisation of the court service. And I think one of the things to recognise from that, which I think comes out of some of the things that have already been said, is the fact that, you know, very often when we talk about things like providing people with digital support in order to access stuff that you come up against, it's quite difficult to sort of extract that from people needing wider support around about, for example, legal advice and emotional support and all the other stuff that often goes from having sort of a person involved, which I think really supports some of the comments that have been made about things really needing to be user-led and context-specific. Because the other thing is just recognising the difference. There may be people who are very comfortable using the internet in one set of circumstances, for example, online shopping. That is very different in contexts which are much higher stakes. So, for example, if you're interacting with something which has real consequences for your legal rights, for example, and that impacts on what is appropriate in different circumstances. And I just very briefly wanted to, because we've talked quite a lot, I think, about digital literacy, but obviously digital exclusion comes in quite a lot of different forms. And one of the other areas I spend quite a lot of time working in is in terms of universal credit and social security, which is digital by default. And a lot of that exclusion has got much more to do with services not being designed with people's real lives in mind. So people not having credit on their phone, not being able to easily access stuff on one device that's shared by lots of people. So it was just, I guess, a couple of points to pick up on some of the complexity of digital exclusion. The age is a really important bit, but not the only bit in terms of what leads to people being shut out from services.
Okay, great. Jeni, I'm going to give you the last word again on this, and there's a lot of praise in the chat I see for the whole idea of the kind of people's panel. I wondered if you could touch on that and explain what that initiative was and how you were trying to inject civil society into these tech debates.
Sure, thanks. So yes, the People's Panel on AI, which Margaret was part of, was it's something that we ran alongside the AI Safety Summit last year, where we were trying to get the government to understand that people's voices were important, and that I think we often assume that like normal people cannot have a say around tech, don't really understand it, or aren't up on all of the kind of complexities of it. And one of the things we really wanted to demonstrate and did with that panel is that actually they are able to say what it is that they want in their lives and what they want their lives to look like, and the kind of role that technology should have in it. I just wanted to bring in this bit about, because we talked about NHS app, and obviously there's also, you know, a lot of digital services accessed through Gov.uk. We have this kind of very centralized notion about what these applications these digital public services should look like. I think we need to be paying a lot more attention to how local government is actually going to be supplying services, whether those are digitized or not, and enabling them to have some flexibility around how they deliver those services and the kinds of priorities that they have based on the particular communities that they're serving in their local areas. So I know we don't have much time to go into it now, but I'd love to see stuff in the chat as well about how we make these kinds of digital services much more like locally aware in the way in which they're designed too.
Great. Thank you very much for that. So on our third question, we have Nicola from Understanding Patient Data. Would you like to pose your question, Nicola?
Yeah, thank you. So Understanding Patient Data, we're a small not-for-profit organisation that aims to make the use of health data more visible, understandable and trustworthy. And before that, I was in the civil service working on lots of data and technology projects. So everyone kind of agrees there's a lot of value in using health data, whether it's for improving people's care, planning, changing, evaluating health services, enabling medical research, developing bespoke initiatives to reduce health inequalities, and also developing products and services in the private sector that could be used in the NHS and in health services across the world. There has also been, comparative to previous years, a lot of financial investment in health data and technology programs. So there's been about £500 million for the Federated Data Platform and 175 million for over 3 years for the Secure Data Environments Programme. And these programs are intended to make data available to many users, so academic researchers, medical research charities, biotech, health tech, pharma companies, governments, and those working in the NHS themselves. Some of these projects have only recently started, so we don't know if they will be successful yet, but there is some skepticism, which is natural when we consider that some previous programs haven't always been successful. For example, care.data or the general practice data for research and planning program. In terms of trust, we know that trust in the use of NHS data is generally high, but some surveys show it's been decreasing, and some of those past failed projects or concerns about current ones add to these risks about trustworthiness. Some of these concerns also relate to the increased use of big tech. So it's not just privacy related, but also about whether decisions align with people's values and who seeks to gain from such programs. I know people across the panel have done quite a lot of work on these areas. So I suppose my question is, who gets to decide and govern who has access to health data and under what terms?
Thank you very much for the question. Jeegar, I'm going to start with you on this because Tony Blair Institute have done a lot of work on this, and your report on harnessing data for health talks about a kind of new national purpose and the possibilities of using data in incredibly constructive and positive ways. So can you answer Nicola's challenge?
Yes, thank you for the question, Nicola. I know you've engaged with some of my colleagues on these issues. So we at TBI, we see there's kind of two elements of the health data story. One is ensuring every patient has an electronic health record, again, so that you're not having to be the middleman between transferring your hospital test results to your GP, and it's all kind of stored in one place, and you've got a record of your health, and again, controllable. You have control over how it's shared, who it's shared with, and for what purposes. The second bit of the health data story that we tell is around creating a national data trust, and very much building on the principles and approach that Nicola just set out around enabling access to things like secure data environment for medical research. The reason why we call for a national data trust is a couple of things. One, as Nicola said, there's been efforts to try to take advantage of health data to improve patient care, to strengthen the NHS, to accelerate medical discovery. But we think a coordinated approach to the National Data Trust will do a couple of things. One, it'll be majority owned by the government, partly potentially owned by the private sector with investment from them. But access will only be determined for trusted researchers to be interested in either accelerating medical discovery or to accelerate and facilitate clinical trials. All the data would be anonymized, and we think that's a way to accelerate the access to data, health data, on an anonymous basis, to accelerate and support patient care, to support the NHS, put it more sustainable footing, and to accelerate the drug discovery and medical discovery. We understand that there's got to be public trust in this system, and so the last thing I'll say is, we're working with respected experts, some of our own critics, Joe Zhang from Imperial and Jess Morley, to understand, even in the first instance, okay, what is the current ecosystem of health data out there right now? Can we visualize that? So, both the public, but also, NHS, health workers, et cetera, know what data is available. And that then allows us, as we're designing, whether it's secure data environments or our national data trust, to ensure that there are proper guardrails, governance structures, and public trust in that system. Pause there, and others will have comments.
Great. James, I'd like to bring you in here. You've written a lot about the need to create new institutions in this digital age. Jeegar's talking about National Data Trust. In the Labour manifesto, there's also a call to create a national data library. I don't know whether that is very different. I mean, it says in the manifesto that this would bring together existing research programs and help deliver data-driven public services whilst maintaining strong safeguards and ensuring all of the public benefit. No difficulty in doing that at all. But James, what do you think about this?
I don't know. I've just asked ChatGPT what's the National Data Library, but I think I'm up for what it could mean, which I think is probably as some of the examples just given. So I mean, there's the sort of minimalist version of it where it's slightly more renovating some of the the very good work that happened around data registers and sort of single sources of truth, which still don't exist in large parts of the public sector. A sort of single source of truth about where things are and what things exist. And then there's lots of obviously great work for many decades now on open data, opening up data sets, making national statistics and other data sets more easily accessible. I hope this means more towards the idea of data trusts, because for me the game-changing piece is when you bring in sort of less conventional data sets and combine them. So satellite data, commercial data, and the huge value if you could get into big text data, other large sources of consumer data, and make that safely available for researchers and others, even innovators, entrepreneurs. That's when I think you get into the game-changing benefits of productivity, innovation. So I hope it's the boldest version of that, and we'll get a chance to shape it towards that.
Jeni, you want to come in here, and you've done a lot of work on kind of what the public thinks about health data in particular. I wondered if I could ask you also about what you made of the government's deal with Palantir on healthcare data.
Yeah, so I mean, there's been a whole bunch of these kinds of initiatives to try and make data accessible for different kinds of reasons. So, there's as well as the ones that James was talking about, there's the ONS's integrated data service, which it's currently working on around health data. You've got the stuff that HDR UK is doing with the Health Data Research Innovation Gateway. And obviously you've got the Federated Data Platform, which is provided by Palantir to pull together NHS data, patient records or something in order to, in some way, it's all very unclear, provide better kinds of services in the NHS. I think the thing that is one of the things that really bothers me around some of these ideas is that the fundamentals, like the fundamental purpose for these kinds of systems, really affects how you want to design them and the kind of governance that they should have and the kind of public trust that you're going to have in them. And in a lot of these places, you're seeing these purposes intermingled with each other. So you look at the Onward proposal around the British Library of Data and TBI's proposal around the National Data Trust for Health Data. And really the primary purpose is to unlock innovation, to make data available for growing a particular sector and for developing new tools or new drugs or whatever. In comparison, the way that it's worded in the manifesto, the National Data Library seems to be about really oriented towards helping public services to do better, to create an evidence base which helps it to develop. And what we know from what the public thinks is that it's very into, generally, the public is very into public benefit out of public data and really quite skeptical about private profit out of public data. And what worries me is that having looked at a number of these kinds of initiatives, is that if there's not clarity about its purpose and the proper governance put in place, then people will opt out, will get worse quality data, will get faulty conclusions off the back of it, will even get, and this is based on the research that we did talking with patients, people reluctant to actually engage with public services, not going to their doctor because they are worried about the way in which the data that they reveal there might be used against them, maybe by other kind of nefarious parts of government that they're worried about, or by some kind of private company in the future. So for me, then we really need to, the Labour government really needs to get real clarity about what the purpose of this National Data Library actually is, and then include the public in the governance of it as a matter of course, so that the people who are affected by data sharing are involved in working out those details about who can have access to what and for what purpose. And I actually think to build public trust, we also need to show that that governance is working and that there's some blocking of access to data in some cases to demonstrate that the public, that there's somebody who's got the public's back to actually protect in cases where it could go wrong. And that's with all of my general, background of knowing that there are enough barriers already towards data sharing, enough kind of cultural barriers, technology barriers, and all of these. But if we don't keep the public in the loop and on side and actually having some democratic control over these kinds of systems, I'm really worried about the kind of backlash that there will be. especially because we know that that backlash then reverberates through other kinds of initiatives into the future and in other domains.
Okay, Caroline, I'd like to ask your opinion on this because we've got two different strands of the debate. We all agree, I think, that we want a kind of pro-innovation policy, that data is an enormous resource that could produce enormous public good in terms of research, drug discovery, and so on, better patient outcomes. But at the same time, we're also expressing a lot of concerns about who owns that data, how it is used. Can healthcare data ever be anonymized satisfactorily? So can we balance these two public desires?
So I guess the bit where our particular sort of concerns that have come in is more about what then happens with what gets fed back into the system in terms of that data being used for decisions. And that's not just in terms of individual decisions, but kind of decisions about strategically what we're doing and how we're doing it. And I think that comes, implicit within this is this bit about, data going out in private companies to look at, research, innovate. And there was a mention right back at the beginning of this to bridges and public sector quality duty, and the court in that case was very clear about the fact that when you pass things on to private companies in order to sort of innovate and develop stuff, that you still as a public body have responsibility for where that goes and understanding how it's being used and whether there are sort of discriminatory implications of that. And I think the reason why I highlight that is the fact is that understanding that it's the importance within this of ensuring that you still have that trail through of understanding as a public body and a public sector about how decisions are being taken about people, what that's based on, and how that's been reached, and keeping control of that, I guess. And I think the other thing I just wanted to flag, which is slightly tangential but related, is the fact that it's really positive, the focus in terms of how data can be used for good. But the other thing that is really important is about the data and the understanding, the evidence base of how automation is impacting on people. And we know from the different ways that we've engaged either through casework or through research or Freedom of Information Act requests, that there's often a lack of data available to public bodies to understand how the things that's being developed are impacting people. So alongside that focus on developing data for research purposes and understanding and data for developing things, it's also really important that there's a commensurate focus on understanding how those things are impacting on people, and that we know what the potential risks are before things are adopted or used as well.
Great. Jeegar, you wanted to come back on this?
Yeah, right on, Jeni's concern around how do you make sure that the public have confidence in it. They go to their GP, how is their data going to be used? The most direct way to do this, to give public confidence and understanding about what data is being collected, how it's being used, is a digital ID that they can log in to see where they're, whether it's on the phone, a computer, they can talk to someone. What data is held by me, how it's being used, is there a snail's trail of what's happening, and how you then can opt in or opt out of what that's being shared with. In the health setting, it is an electronic health record that kind of monitors all that and allows individuals to understand, okay, yes, if I do share this information with my GP, I can have control over who sees that and in what context. And it won't be seen by my employer because they don't have any access to that, and I can stop that. And I think that's really important to then begin as part of that public trust, is to give them a direct sense of control rather than kind of an indirect sense of control through other types of form. That for us comes first. Okay.
I think Terence Eden has posed a question in the chat saying that we really ought to hold Labour to account on the insistence that people join these services, are almost pushed into these services, which very much echoes Margaret's point earlier about whether these are compulsory or mandatory systems. So, Jeni, could you pick that up in answering whatever you wanted to answer?
Yeah, I did. I just wanted to respond to Jeegar's point. I mean, when you actually look at the research about how people interact with privacy control systems and that kind of notice and consent kind of model, they don't. And that's for a whole bunch of reasons, to do with their to do with their capacity, to do with their knowledge and understanding, to do with the kind of patterns that systems put around the way in which they're presented with those kinds of choices. And so if we are going, we really need to move away from thinking that this is not to say that consent isn't an important thing. There should be those options, but we need to move well away from thinking that those are the only way in which people actually get to have a say over the way in which data gets used, or that it provides reassurance to know that there's some kind of big trace somewhere of all of the ways in which that gets used. It's our institutions, it's our systems, it's our governance processes, it's the civil society organizations that are fighting for people that actually give the kind of confidence that people can go around their everyday lives and not have to worry about it, not have to go and check up on the way in which their health records are used or their other public sector data is used. And so that's the bit that we really need to strengthen, not the individual kind of controls.
Okay, if we could satisfy people's concerns about how their data is being used, do you think it should be mandatory that people's healthcare data should be open to scientific research? I was at a fascinating kind of AI and healthcare conference a while back where a very senior European official made that case, was saying that if we believe in free, publicly funded healthcare systems in Europe, the price for that should be that the people who use those systems should donate their data for public good. Is that an argument?
I think that when you go and talk to people in citizens' juries, so you get a representative set of people talking about how to make these controls happen, they always want to have individual opt-out. And I think that we need to match expectations from people that enable them to do that while having those kind of broader governance level things. There are places obviously in our lives where data gets collected and we don't have any choice about the way in which it gets used, most notably the census. So it is possible for us to have places where that happens. But if you understand what people's expectations are, consent is one of the things that they always want to have, particularly around sensitive data like health data.
Okay, now I'm very nearly out of time, so I'm going to ask all of you on the panel to come up with one recommendation for the incoming Labour government, assuming there is an incoming Labour government, what they should do to address the concerns that we have been raised, and also to maximise the opportunities that I think we have all flagged as well. But Jeegar, did you want to come back on a particular point in that previous debate? But then if you could come and make your one recommendation.
Opt-out is the right answer on this. And to the previous conversation, it's the way you get consent. You have control. You have your information said, do I want to share this or not? The opt-out is the right answer. I think the one thing that Labour should think about, and we said this, is to begin to think about, yes, you can do some of this off the shelf stuff, but a lot of what we talk about TBI is underpinned by some form of digital identification, and building off the one login system to create some sort of individual digital identity that can then be in a digital wallet, NHS app, etc. I think that's the building block off which a lot of these concerns can be found.
Okay, great. Caroline, what would be your one recommendation?
Yeah, so reflecting on what I think was the key theme going through a lot of this in terms of trust, but I think one of the key things that can be done easily is around about transparency. So like say adopting ATRS statutorily, making sure it's actually complied with, and looking at individual transparency as well when people have decisions taken about them.
Great, thank you. James?
Sorry, getting distracted by the chat as always. I think, one thing for Labour, maybe if I squeak in two things. One thing for Labour is just listen deeply to the practitioners that have now been working on these kinds of complicated challenges for many years. It's often difficult in transitions of government. Insight and intelligence and wisdom gets lost if we end up with a transition. And then just one very brief reflection is I often find in discussions like this, the tone is sort of overwhelmingly worried, focused on risk, negative, understandably so. I completely get it. And I share a lot of the worries. But I just think one of the bigger challenges is this huge capability gap between the private sector and public institutions on technology and data. And we're not going to close that gap or narrow it, even if we don't sort of have some positive vision and lean into this a bit. So I think that's just something for people like ourselves to think about in these conversations.
Okay, great. And Jeni?
Yeah, and I really agree about needing to have a positive vision, but I think a positive vision doesn't necessarily mean being positive about all technology. I think we can have a positive vision that has good governance in it, that has good mechanisms for bringing the voice of people and communities into the design and development and deployment of these systems. And for me, that's my major recommendation. It's integrate more with what the public, with the public, understand what they say, give them a powerful say.
Fabulous. Thank you very much for the panelists for all of their contributions and for coming up with digital IDs, transparency, listen to the practitioners and have a positive vision for data use. So Adam, back to you.
Thank you, John, and thank you everyone on the panel for a really brilliant and robust and dynamic conversation. Really looking forward to continue working with you and all of the other brilliant chat on the call as well. We'll be running more events like this and be continuing to engage in this. You can find our newsletter subscription link there in the chat, and also just to finally flag that there is another event where party political representatives will be speaking at 8 p.m. today, which may or may not be more exciting than the football. So you can make your choices there, or perhaps have it on a dual screen and see what is most spicy. So yeah, that's all from us at Connected by Data, and thanks again to the whole panel for a really great discussion, and stay in touch.